The first couple days in, I felt maybe a little tired. And by day 3, the worst of the bruising had come out. So it's a little uncomfortable looking at yourself in the mirror like that. However, as far as discomfort and pain, there was literally little to none. You know, I just made sure I put my ice packs on consistently for even 2 to 3 days post-op, and I really had no problems.
Recovery from surgery, just like recovery from an injury, has a timeline. And most people find that swelling and bruising increases over the first 2 or 3 days after surgery and then turns the corner and starts to improve. And that's just like when you sprain your ankle. You know, the first night it's not too bad, but day 2 or 3 is usually when you get the most swelling. So that's pretty much expected with any surgical procedure. When we're doing eyelid surgery, of course, we're working on 2 different eyes. They're 2 surgical sites, so one is going to bruise more than the other, one is going to swell more than the other, and that's common.
Both eyes were definitely bruised and swollen, but the right eye was more, the bruising was more prominent. The left eye seemed to heal a little bit quicker than the right eye.
Patients who take blood thinners or who take aspirin or things like that might get more bruising than another. And there's a certain variation from person to person as well. Some people bruise easily and some people don't. So that variation in swelling and bruising that we see in most patients is typical, but most people find that after the 3rd or 4th day post-surgery, their symptoms or their bruising and swelling and their appearance really starts to improve dramatically. In fact, it improves as quickly as it got worse. What you would expect at day 3 or at day 2 or 3 is that you're going to have the edges of a stitch coming out on either side, and we usually put a small piece of tape on that to keep them out of the way. You would expect that your eyelids on top will be swollen, and you'll also have some swelling of your lower lids, even though that's not something that we operated on. Bruising descends with gravity. So because we stand upright, the bruising from the upper lids descends into the lower lids and cheeks, and that's normal. If you stand on your head for 3 days after the surgery, then you'd get bruising in your forehead. The stitch that comes out from the corner is one end of a stitch that I don't usually tie a knot in. And so we keep it out of the way so it doesn't curl around and poke the patient in the eye. The reason I use that particular type of closure is without having any knots, the suture is literally just slipped out and it's pulled out very gently. It just takes about 2 or 3 seconds on each side and the patients are done. So it's a nice easy way to remove the sutures afterwards in those patients who are able to come back to see me for suture removal.
The only changes that I was making to my daily life was I actually wasn't really going out much. I kind of stayed close to home. You know, I got back into my routine of, you know, doing chores, and for me, I have the, you know, luxury that I can work from home from times. But day 3 and 4, and even day 5 too, I was still kind of staying close to home.